Michelle Sullivan with Global Medical News Network at the International Stroke Conference in Los Angeles. Here at the International Stroke Conference, we've learned that high-tech therapy isn't necessarily the best therapy when it comes to learning to walk again after a stroke. The LEAPS trial demonstrated that stroke patients who trained at home regained their ability to walk just as well as those who trained in an outpatient setting with an advanced locomotor system.
So the purpose of this trial was to compare two interventions. One is what we call a walking recovery program, which includes body weight supported treadmill training. In essence, what you do is you suspend someone with a body weight support system over a treadmill, and your goal is to get them to walk and to more assimilate normal walking and to get to normal walking speed. And therapists offer assistance if they can't do that. And the second intervention was a home-based physical therapy program, which isn't your typical home-based physical therapy program. It was a very rigorous program. We progressed the patients, and we worked on strength, balance with them, and we encouraged them to walk. Now, both of the interventions got the same exposure. They got 30 to 36 visits 3 times a week for over a course of 12 to 16 weeks. And on average, they were in therapy for anywhere from 75 to 90 minutes. Individuals in this trial were living in the community, but they could not walk at a community rate, and some of them were very homebound. There are 3 groups. One we call the early LTP group, which is this early walking recovery group. They got the intervention at 2 months, and the home therapy program was given at 2 months. And then there was a third group that was waitlisted, and they got the intervention at 6 months. Again, our primary outcome was at 1 year, did all 3 groups improve their functional level of walking? And the answer is yes, and there was not any superiority of the high-tech locomotor training program using the body weight supported treadmill system.
A secondary analysis of the 6-month outcomes found that the waitlisted group improved about half as much as the active group in walking speed, as well as in quality of life and activities of daily living. But by 12 months, the waitlisted group had improved just as much as those patients who were treated earlier. In terms of adverse events, the in-home program appeared to be safer than either locomotor program, Dr. Duncan said. Walking is a critical part of stroke recovery and one the brain is ready to undertake after the event, said Dr. Jeffrey Saver.
The LEAPS trial, I think, is a transformative result. It tells us that doing a lot of gait assistance and training is a lot better than doing a little. We knew this for upper extremity function before. Now we know it for lower extremity function. Whether you did it with home-based physical therapy or sophisticated locomotor apparatus, that didn't matter so much, but a lot was better than what we usually do right now, which is only a little.